Hey, it's Jessica Maslak with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we are getting into all sorts of issues that are longtime healthcare issues that just seem to never get solved. The provider directory, cost transparency, enrolling for your health plan. And here to tell us all about how the game is changing for all of these things is the co-founder and CEO of Ribbon Health. Please meet Nate Maslak. How are you, Nate?
I'm good. Thank you so much for having me on today.
I'm so excited to talk to you. So, especially about price transparency, because there's those new CMS rules that have come into play. And I understand you guys have a new and better way of doing price transparency, particularly as it stands with the patient perspective. But before we get to that, I really just want to hear about Ribbon Health. So, I mean, like what I have heard about you guys is like, oh, another API platform, API data platform that healthcare organizations can plug into. But what you guys have is this really robust, comprehensive collection of data on providers, on plans, on healthcare costs, on networks, things like that. So tell me a little bit about Ribbon. What's the business you've built?
Yeah, that's exactly right. So our company exists to be able to be the infrastructure behind the scenes anywhere that a care decision is made. So as we think about the billions of care decisions getting made in the US at any given year, our focus is to look behind the scenes of where those care decisions happen so that when somebody is seeking care, they can make sure that they're getting care that's convenient, cost effective, and high quality. And we're kind of the company behind the scenes. We like to be the healthcare plumbing. So our data platform really focuses on fueling these different healthcare enterprises like health insurance plans, provider organizations, digital care solutions with the data necessary to make that care decision on the provider. So first, the provider directory. Who is this doctor? Where do they practice? Still a really hard problem, still a really important problem. But that's the foundation of these care decisions. And then on top of that, we layer on which insurance plans doctors accept, the cost and quality of care that they deliver, including transparency, as you mentioned. And also, very importantly, moving into a world where we can complete the action, again, behind the scenes. So when somebody finds a doctor that they need, leveraging Ribbon's API, actually being able to book that appointment or send that referral so that we can really close the loop and that our customers can do what it is that they do best, which is deliver care or navigate care or pay for care, all of these things that are so hard as is without having to worry of, did I get the phone number right? So we try to take that off their hands.
Okay, like this is a legit problem. Like I've been doing interviews with companies that have been trying to fix provider directory since like 2015. And it's like for me, like at first I was like, why is this so hard? But Nate, why is this so hard? And how are you really going to fix this? Because like there's a stat on your website that says 50% of provider directories are like still
That's
out
right.
of date. So what I mean, and how are you going to fix this once and for all?
Yeah, I mean, we were shocked to find how hard this is in 2015 as well. So just a little bit of background
Yeah,
history on
tell us.
Ribbon. We didn't start out as an enterprise platform. We started out as a care navigation company. Our whole thesis was that you had these care navigation companies that at the time were largely call centers that were focused primarily on these large employers. And there was this whole part of the market that was getting left behind of consumers, small employers that also needed care navigation. And care navigation works, drives outcomes, it saves on costs. And so my co-founder and I, when we met, we really focused in on how do you build a more digitally enabled solution to drive better care navigation. So we had all these products that were focused on pulling people in. So symptom-checker, condition content, price transparency. So going back to that. And all of that was really focused on getting people in so that when they needed care, they could find a doctor. And we built a doctor finder like a lot of other organizations do. And we felt like we were off to the races with 80% month-over-month engagement. We signed our first few employers, and then people started calling in and they hated us.
Oh
And we
no.
couldn't figure out why. And people would say, I finally got my husband to go see a doctor for the first time in 5 years. And we drove there. And when we showed up, we were at a TD Ameritrade. It was a bank, not a doctor's office. How is this your product? And we couldn't understand it because we were tapping into the government data source that licenses providers and tells us their address and their phone number. And so we went in and we actually sampled their own data. And we found that 50% of it was garbage. And we were hurting people with this product because it's not just that somebody showed up to a bank, it's that probably they weren't going to go back to search for care again. And so we were not only hurting access to care, but we were actually hurting their future health. And so we started trying to fix that for ourselves. My co-founder and I both come from a predictive analytics background. We saw that as we got a little bit more information coming into our platform, it got a little bit more accurate. And we said, what if we just really took that to its extreme? And as we did that and the product got more accurate, a bunch of our competitors started coming to us asking if they could license that data. And we couldn't believe it. Like doctor phone numbers, doctor addresses. This is a white pages problem. And yet everybody else was struggling to solve it. And that's so wasteful because all of these brilliant minds, all of these brilliant resources were being spent trying to find the right phone number for a doctor. And so our bet, our whole view was, let's be the company that actually democratizes this, that starts to chip away at this problem and solves it, and makes it easier for everybody else to build on top of. So that's kind of how we got here today. And I'm happy to get into methodology and everything else, but I think it's important to kind of share that, we too were surprised and angry and confused
Oh
when
my
we found
God,
out
like
about this.
this is like the greatest like unsolved mystery of like, why is this still a problem? Like if you Google something, it will tell you, is it even busy at the hour with which you are looking to go? But like
Yep.
you want to go to find a doctor, you're at a TD Ameritrade. I just don't understand how we live in a world like that. I
Yeah,
just don't understand.
that's exactly right.
So
Yeah.
where
Yeah.
do
It's
you guys
incredibly frustrating.
where do you guys get your data? Like, are you guys pulling that in yourselves? Like, is it your own data when it comes? And I know you have different use cases, and I want to get into some of the other ones as
Yep.
well. But when it comes to provider directory specifically, are you pulling this from someplace else and just like putting together all of the different sources to see what's true, or is it like you guys are like have somebody on the phone calling? Like, where do you guys get your data from?
Yeah. So our view is that the right information is out there somewhere. And the really important question is, how do you actually find it and know that that's the right piece of information? And so we're aggregating data from over thousands of different data sources. We scrape the open web, we have partnerships, we have data licenses, we tap into government data sets. And also really importantly, our customers are also contributing data back into Ribbon. And they do that not to help Ribbon or to help somebody else. They do that because it's important for them to be able to maintain their sources of truth on their own providers or the providers that they're referring to. So I'll get back to that in a second. But just looking across the thousands of different data sources that we see coming in, it is an absolute mess. There is not a single accurate data source that hits our system consistently. So just to give you a sense for it, we see 50 phone numbers per doctor hit our system at any
What?
given moment.
No
And so
way.
our job is to figure out what's right and what's wrong. Yeah, it's really shocking. And I think even for us, the more different data sources that we add, the worse that problem becomes. And if you humanize that, this is information that people are actually looking at and finding and sifting through and calling to try to find care when they are sick, when they're lying in bed and they don't know what's wrong and they know they need to see a doctor. And the thing that they have to navigate is, which of these 6 phone numbers gets me to the right place where I can sit on hold for an hour to get care. So we want to make that problem go away. So the way that we do this is by building predictive models that figure out, if 800 sources agree and 200 sources disagree, what's the probability of them being right or wrong? And that's where those customer contributions come back into the picture. Our customers are sending referrals. They're booking appointments. They're talking to doctors. And when a doctor is moving, let's say that one of our customers calls to book a referral and they say, hey, we're actually moving across the street next week to 123 Main Street. They go into their referral workflow. They type in, it's not 100 Main Street, it's 123 Main Street. Well, all of that is maintained by Ribbon because all of our customers get a private copy of Ribbon. That comes back to us, and that actually helps train our machine learning models to figure out what's right and what's wrong. So there's a real network effect here. And by the way, we do have a call center, and we're sampling that to make sure that we're just not making stuff up. It has to be accurate. And through that, we're then able to build this product, deliver it as an API, and our customers, again, continue to iterate on that, edit that information, and the product gets better for everybody involved.
Now, is that same methodology what you also apply to the other different use cases that demonstrate the use of your ability to like build on that API platform and leverage that data? So like in addition to provider directory, I mean, we talked about referral management, care navigation, benefits enrollment.
Yep.
So is it kind of is the same methodology? It's just different data sets that you're pulling from?
Yeah, that's exactly right. We want to make sure that we're bringing the best possible product to market, make it really easy to implement. And that's why we focus on that API approach, and make it really easy to update and edit information because this data is dynamic. It's changing all the time. And so the technology approach here is to make it really easy to update and edit something and have that come back in and improve. So if you're getting into price transparency, you can actually start to understand how close were we on this prediction, and then be able to make improvements to that predictive model so that we keep getting better over time.
Say a little bit more about that because I feel like that's the sexy area right now where we're getting more data than we've ever had before because of CMS's price transparency rules. And there are good actors and there are bad actors who are giving us data and who are making data difficult to comb through, but I'd love to hear what you guys are experiencing there, and like how is what you guys are doing at Ribbon like a game changer when it comes to price
Mhm.
transparency. I remember I worked at a Blues plan. We had the little know before you go tool where you type in your
Yep.
knee replacement and go figure out, but it's like it was very difficult to navigate, let's just say. But that was a lot of years ago. So tell me how you guys are changing the game on the price transparency piece.
Yeah, I think it's still really hard to navigate. And so for us, I think that we're sitting in this moment in the industry where we're able to now access all of this new information that is coming because of, I think, the really important regulations that are put in place. So our approach is to be able to ingest all of the new contract and network information and be able to make sense of it for a consumer, a patient. And so that's always who we have in mind. Even though we're a B2B company, even though we're really an infrastructure company, we're always thinking about the end user who is the patient or the provider making a referral. So the way that we're really approaching this, first, we have an amazing partnership with a company called Turquoise Health that is also mining a lot of this cost transparency data. And so we're working really closely together hand in hand. And we're able to leverage a lot of the great work that they're doing and combine that with a lot of the work that we've already done and are doing to first try to paint a picture of all of the machine readable information flowing in on contracted rates.
Okay.
But second, we have to make sense of that from a human being and a patient experience. So if I'm going to get a knee replacement surgery, I do not care that the screw in that knee replacement surgery is contracted at $63 with my health plan. That tells me nothing. I want to know as a patient, I'm going to show up, there's going to be a procedure that happens. Hopefully it's an outpatient procedure, and then I'm going to go home. And I want to know how much it's going to cost me based on my plan design. And so we're actually ingesting this information, we're bundling it, understanding what is a typical bundle of procedures. So we have one of the biggest, if not the biggest, claims data assets that we've licensed in our broader product. And we're able to leverage that to understand what typically happens in a knee replacement surgery. What are all the codes that come in? How many screws get put in a knee replacement
Yeah, right.
surgery? Not how many are supposed to, how many are put
Are
in on
actually done.
average. Exactly. And then through that, being able to make a prediction. And then the second piece here is being able to tie it back to the provider. So everything comes back to directory as much as we don't want it to. It's not glamorous, it's not sexy, but it is foundational. The rate at which a provider or a facility charges is going to change based on who the doctor is, which location they're performing this procedure, and even if they're at the exact same hospital, which floor are they on and what color is their badge? Are they renting that facility today as an independent practitioner, or are they an employee of the hospital? Because that is two different facilities that have two different rates. So Ribbon is actually able to make
Whoa.
sense of all of that, tie it back directory, leverage the claims data that we have, and out of that, be able to provide an accurate prediction on the procedure tied back to that person's health plan benefits, saying, based on where you are in your deductible and based on the expected costs, this is a much more narrow range or actual prediction of how much something is going to cost. And it all starts by tapping into this really messy machine readable formats that we're working on with Turquoise to make sense of that for these different use cases.
That's incredible on so many different levels. I can't even, it's like, it blows my mind. I mean, the fact that you can make it relevant to somebody specifically for their plan and where they're at with their deductible is like remarkable to me. The other thing that I think is interesting is, what kind of feedback are you getting? Or are you hearing anything from the providers? Because this is all new for them. And there's been a lot of
Yep.
resistance on the price transparency. The hospitals have pushed back. But when you get down to an individual doctor, I'm very curious about what kind of like stop publishing especially if the guy down the street's not published yet. So what are you
Yep.
hearing from the provider community? I'm so curious on that piece.
Yeah, I think like any important regulation, you're going to have people who are pro and people who are against. And I have a lot of empathy for the folks on both sides of that, really thinking through what that means for their business. I get it. It's really hard to run a practice. Doctors are overwhelmed, they're burnt out. And so this is another thing they have to worry about. So from that standpoint, I do get it. But at the end of the day, the world is moving into a more transparent place. And consumers, people, patients are expecting more. The way that I watch somebody interact with our healthcare system now is completely different than when I would sit down and watch somebody interact with it 5 years ago, because all the other technologies around us have changed fundamentally. Look at fintech. Before, to get a no-fee banking account, you would have to have a private banker. And now I can download one of 50 apps on my phone, and there's all this infrastructure in place to make it happen. And so the world has moved in that direction. And our bet and our hope and our prediction is that healthcare is moving in the same place. So going back to a provider's reaction, I think that this actually benefits the providers that are most efficient and that are most cost effective, because they should be able to advertise that and have patients vote with their feet. There are a lot of other considerations. Quality is important. Access is important. Patient satisfaction is important. How far somebody is from your facility is important. And so I don't want to say that this is like this holy grail that just solves all of our problems. There's a lot more to it. I think providers need to understand that. But at the end of the day, we should want patients to be informed so that they can match themselves to the right providers for them. And I think providers benefit from that as well.
I agree with you on that for sure. I mean, the rising tide lifts all boats, right? I want to hear a little bit before I ask you about the business. Last use case that I'm curious about is what you guys are doing in insurance enrollment, because this is like also another one of those like talk about like the bane of all existence in healthcare. You're like, yeah, we'll do provider directory, cost transparency, and why not just do insurance enrollment too? Because that's another fun one. So what's the situation there? Explain to me how you guys are leveraging your platform to make that easier.
Yeah, so taking a step back for a second, all of the different use cases we focus on around enrollment, referral management, provider data management for directory, these are all actually the same problem that use different words to describe it because of the different parts of the ecosystem that we're in. And so when somebody's making an insurance enrollment decision, in our research, what we've seen, the first thing that they look at is, how much does this cost me? And then the second thing that they look at is my doctor going to be enrolled in this plan? So if I just all of a sudden saw that my premiums increased, or I switch an employer, and so all of a sudden my old insurance plan isn't available, first question people ask is, can I keep my doctor?
Like, provider directory. It all goes back to that.
Exactly. That's exactly right. Or if you're enrolling in a plan because let's say that there's a very extreme chronic condition that somebody is struggling. Let's say that they have IBD and they need to make sure that they have the biggest density of gastroenterologists who specialize in irritable bowel disease near them so that they have their options because they don't yet know who it is because they're switching plans. They want to understand that information. Well, that comes back to directory and insurance and network, except the network information, plus focus areas, cost of care, quality. All of these questions are being decided on. It's just that instead of choosing a doctor, somebody's choosing a plan based on the network. And so we power those use cases for health plan brokers and health insurance companies to make sure that they have a sense of their own internal network, how it stacks up across competitive networks so that they know if they're entering a new market, what they need to look like. And when they're actually selling that plan, to inform the patient, and the best plans in that case will win. And we believe that that makes a stronger market and a stronger healthcare system.
Okay, I want to transition and talk about the business for a second.
Yeah.
This is a good segue here. So, I mean, I'm really impressed. We'll get into the impressive venture funding that you have because you have some great VCs behind you. But I'm curious to hear first, what's your client mix like? Because I mean, like when you're talking to me about like, I mean, there's a lot of different people who would be interested in what you have to offer. So you working like for like primarily with health plans, hospital systems, doc finder, things like. Give us a sense of what your mix is like.
Yeah. So we are working with about 50 healthcare enterprises in the ecosystem today, and the number continues to grow very rapidly. And our revenue is split about a third, a third, a third across health plans, provider organizations, and patient-facing solutions. And that's actually always been the case since the very beginning of Ribbon. And I love that because, again, I maintain that all of these organizations, when it comes to provider data, are solving the same problems. And they've been solving them in silos for so long. Provider groups that have different information than health plans. Health plans are getting information from provider groups, patient-facing solutions get this data somewhere else. And if all of them were talking and providing this is what interoperability is supposed to be, then this problem would get easier to solve. And so Ribbon sits at the center of all of these different platforms and solutions, and we're capturing different types of signal and sharing it back out with them. And so as I look forward 5 years, I want Ribbon to be powering all of the hundreds of thousands of digitally enabled healthcare solutions, and I want them all interacting with each other through Ribbon as that source of truth for them.
That's cool. How do you guys make your money? Is it like, are people paying for access to the platform, or like, talk to me a little bit about the revenue model? What can you share with us?
Yeah. So our customers are paying us as a SaaS model. So our customers sign up for annual or longer licenses. We like to go really deep with our customers. We go deep with them on the implementation as well as providing them with best-in-class technology. And our view is that we hope to build really long-term relationships with our customers. So we've been incredibly sticky across our book of customer base. We've had the same customers since the very beginning, and we're so proud of that. And we're working with upstarts that are now publicly traded companies that are transforming how healthcare is being delivered in this country or paid for in this country. And so I hope that that model continues. And as we think about kind of continue to go across the market, we're also thinking about different ways that we can create pricing models that may be a little bit more flexible for smaller companies or can provide a little bit more of a transaction layer so folks can get started at a smaller scale. So a lot more work to do there. But at the end of the day, we price based on ROI. So when we start working with a health plan, the very first thing we do is understand how much savings could they get in the first 6 months and the first 12 months of working with Ribbon. So none of this like 5 years from now, imagine your MLR. That's important. We do model that and we work with actuaries to get a sense for that. But if you're a health plan executive, you're thinking about how this saves you money tomorrow, how this helps drive automation, how this helps make my workforce more efficient. So we lean into that. And then the second piece is we don't just drop off an API token or send them a file of data and disappear and come back 4 months later, which is what we've seen a lot of companies in the directory space do. We actually embed ourselves with them and we understand, where do you want data to flow? How do you want it to come back in? And if they tell us which button they want to trigger a doctor search, we will point them in our documentation to the very specific line of code that they need to implement there to make sure that that works well. Because this is not just technology. And you're asking, all these provider directory companies. I think for a long time we as an industry, and we thought this ourselves too, if you provide the technology, the problem goes away. But actually, technology is half the battle. And the other half is the business processes that are in place and the implementation to make sure that at the end of the day, the patient can capture the outcome and all of those savings and improvements in quality and better care delivery models, they come from that moment. So we start with technology and we're really focused on implementation as well.
Oh my gosh, Nate, that's so wise. It's like, yes, the technology is only half of the solution. It's like you need to understand the business process and then like what's going to happen and how it affects workflows. Yes. I want to ask about the future because like the thing that really blew my mind too, which I mean, listening to you, like I totally get it, but I'm like, I have to admit, I was skeptical. I'm like, really, another provider director, like, why is this one so different? But you look at who you have backing you. I mean, Andreessen Horowitz backed your Series A, and then General Catalyst, your B. Like those are two of my like gold standard pick VCs in health tech. Like those VCs know what they're doing when it comes to this space. I'm curious to hear like what your plans are for the future. I mean, we saw General Catalyst as your Series B. That was about a year ago, November of 21. So it's like, what's happening next? You've raised about, I think, 54 million dollars total.
Yep.
So what are you guys going to do next? I mean, what's the immediate scale up plan? I mean, we've heard you kind of pepper in some little things about what you want to do, some different lines of business to get into, and ultimately providing all of this data for all of the tens of thousands of different digital health tech companies that are out there. But like, what's on the short-term roadmap? You need like a 3-year outlook. What's going on?
Yeah. So in the short term, there are a few areas that we're focused on. I think the first one that's most important is that we continue to do what we do well, even better. So our provider directory, as far as we've measured it in any objective standard, is the most accurate in the ecosystem. But it's not 100% accurate. And when I think of the patient who's lying in bed, who's sick, who's looking for care, for us to say, well, it's better than the other thing is not good enough. It needs to be 100% accurate. We have to hold ourselves to the same standard that other industries do, that things should work. So that's investing in our technology, that's continuing to add new data sources, that's continuing to bulk up the R&D side of our team and hiring more engineers to make sure that these are problems that we look back on and are appalled at the standard that we were okay with. So that's part one. Part two is then also continue to think about what else the industry needs to power every care decision to be convenient, cost-effective, and high quality. So I think right now it's awesome that any product powered by Ribbon can show you the best doctor for you. They're the most cost-effective, that they're near you. But then when it's time to book care, you still have to tap the phone call button on your phone or enter it into your phone and then sit on hold and hope that they pick up. And that's a miserable experience. And so we're thinking about how we can further drive action. So how can an API as a platform complete the full experience from behind the scenes? So one of the products you're going to see come down the pipeline is an API-based scheduling product that we're building out in partnership with a lot of other great companies and really building up this inventory. But over time, I want every single doctor in the US to be online bookable through Ribbon. And to also be able to promote all of these other companies that are in the space working so hard to drive scheduling. So have them all also be a part of the Ribbon network. And then the other place that we're doubling down is I think about the kind of next level of solving these really big, meaty data challenges is productizing provider data management in a way that makes it a lot more accessible. So Provider data management is
Like in
this
English now, Nate, in English.
exactly. Yeah. It's this like ephemeral thing where every
Like
health plan has
provider
to
data
do.
management. I don't even know
Yeah.
what that means.
And every health plan does it. Every provider organization does it. Every year, their industry stats, it's like we spend $10 billion a year on provider data management. And what does that actually mean? And so we want to be able to democratize that and make it easier by building tooling. All of what we do as Ribbon internally to solve these provider data problems, health plans also need that tooling. Provider organizations also need that tooling because they're working on so much provider data. And so we're modularizing that and making that more accessible so that health plans can actually plug and play that into their existing workflows. And again, we work with them to implement that in so they can get more efficient. So kind of going back to the two-pronged approach, one, getting better at what we're already good at by bulking up the infrastructure and the data, but also second, making it actionable. And in some cases, that means making it actionable through price transparency or scheduling. But in other places, making it actionable by allowing enterprises to pull it into their own internal workflows in which they've already invested so much, and then tying all of that together. So when I look forward 3 years from now or 5 years from now, I want Ribbon to be a company that today we power care decisions for over 10 million people in the United States. That needs to become 330 million people across 10 billion care decisions, and us being able to measure and demonstrate the ROI that actually shows that because Ribbon exists, we've been able to eliminate the over $700 billion of waste that happens in our healthcare system because of bad provider data through all of these different approaches that we're describing.
That's so awesome, Nate. I love that. That is really cool. I mean, there are a lot of companies in this space, but I feel like there really is not a clear market leader. So I mean, I think it's very exciting to see who kind of emerges. And I don't think anybody can do like the number of tricks that you guys can do. I'm sure we're gonna get some
Well,
comments and it's going
I'm
really
looking
good.
forward to it. I
But
know I'm
yeah,
sure my friends at these companies are going to be yelling at me, but what I will say is I think the problem is that we as an industry have said like provider directory is a company and a market and a problem, and scheduling is a company and a market and a problem,
yeah.
but it's not. These are features. Like we live in a massive market in healthcare, but ultimately, I as a patient, I don't care who's powering my infrastructure for this plug or this tool, and health plans are frustrated and providers and patient-facing solutions are all frustrated because they have to piecemeal all of these different features together. And that's not fair. If you go into any other industry, if I want to spin up an e-commerce store to sell shoes online, I don't have to implement 47 different tools so I have a functioning website. I have a couple. And so my view is that somebody needs to provide a holistic solution across all of these problems. And that's our big vision. And that's why Ribbon exists. And I think that's why, Juliet and Andreessen and Holly at GC get excited about this vision, because we're thinking about what healthcare can mean in 5 years as a force for good and be the humble plumbing behind the scenes to make it happen.
Oh, I love a good infrastructure play. There's humility there, but it is like it is seriously the most dynamic space right now for me. I love it. So congratulations, Nate. This is awesome. Thank you so much for stopping by. It's such a pleasure to learn about what you're doing. And I really appreciate all of the examples that you gave because I really feel like you brought the technology to life and really made it very relatable. So thank you so much for that.
Thank you so much for having me. This has been a lot of fun.
All right, thank you. All right, everybody, that's Nate Maslak. He is the CEO and co-founder of Ribbon Health. We're just chatting about API and how amazing that's going to be and fixing provider directory and all other like terrible parts of the healthcare system, like enrolling for benefits and so on and so forth. And if you want to check out more interviews with the who's who of health tech as they're changing the way that we do healthcare, you can head on over to my YouTube channel. That's youtube.com/WTF Health. I'm Jessica Namasa. Thanks so much for joining us. We'll talk to you guys again soon. Bye.